Hello, I'm Dr. Jonathan Leach. I'm a GP in Bromsgrove in Worcestershire and I'm clinical lead for the 111 service in the West Midlands. To phone 111 is free from a landline. If you're phoning from a mobile, if you're on a pay-as-you-go, you need £1 credit, but actually that would be reimbursed, so you get that money back if you actually then phone. So actually it's free from mobiles and from a landline. Let's say I dialed 111 at the moment, so what would happen? I would get an initial phone message and then I'm put through, and initially the call is taken by a call handler. The call handler then takes them through this very detailed system whereby they would assess the degree of the problem, and then what they would do is then advise on what might be the best way in which they could get help. Now that might be self-care if it was at a lower level. It could be to go to a pharmacy, it could be to go to a GP, it could be to go to an urgent care centre or a walk-in centre or something along those lines.
So I'm a nurse by profession, and I've worked in a wide variety of settings. And for me, 111, it's about giving patients that clear point of contact to the rest of the NHS. So one of the processes that we've developed within 111 here within the West Midlands is that wherever possible, a clinician will actually speak to the patient and assess their symptoms to make sure that it's appropriate for them to be referred on to the hospital. A lot of calls that we get through 111 actually don't need a clinician to deal with that call. So for instance, you may get a member of the public asking about where the nearest pharmacy is, or is there a dentist open in my area? Those types of calls clearly don't need a clinician to answer that question.
One of the concerns has been that in the press and from other members of the profession is that 111 has been referring a lot of patients to hospital, particularly to the emergency departments. Actually, that's not the case. We've done a lot of work here in the West Midlands, and actually we're receiving probably about 110,000 calls per month, so a very large number. And actually when we look at the numbers of patients which actually we say should go to, for example, one of our local hospital A&E departments, it's about 10 a day. But certainly 10 out of 200, it isn't the vast numbers that perhaps some commentators would say.
One of the things that we actually do is we encourage other healthcare professionals who interact with 111 to give us feedback on the experience. And with that feedback, what we will do is help to develop the service going forward.
Feedback we get from patients is very positive. They like ringing the service. Complaints are very, very small. 0.01%, which is a very, very small number. And obviously we deal with those, but we get a lot of compliments from patients about the way in which 111 has actually managed the call, how they've been dealt with, and actually how their overall problem has been dealt with.
I think it's important to realise that NHS Pathways has been developed by the Royal Colleges. So that will include consultants, it will include nurses, dentists, pharmacists, a whole raft of senior, very specialised clinicians, and it's actually designed for the NHS to be used by the NHS.